Waiting in the doctor's office is something Harold Jackson is used to, but today's visit is a little easier. The news is good, and that hasn't always been the case.
And it just kind of beats so fast it makes you tired, and it didn't do that way all the time, but it got where it was about 90% of the time my heart rate would be up around 120.
Harold had a condition called atrial flutter that occurs here in the upper two chambers of the heart. This condition causes the heart to tire and weaken over time. Harold had been living with this for years and thought there was no hope.
And there was a time that they couldn't do anything for someone who had had open heart surgery because of the scar tissue that the open heart surgery caused. But Dr. Wathen had developed a new procedure.
Dr. Mark Wathen spent over 20 years at Vanderbilt heading up their electrophysiology department, and his services are new to Cookeville Regional. He had a new treatment for Harold that changed his life.
So he just taught me right through it for an hour and a half, and I didn't have any pain at all. And I was glad when it was over, and immediately my heart rate went to what it was supposed to be.
Dr. Wathen describes that pivotal moment.
And that moment is a beautiful moment because you can see this 6-year rhythm stop. In one moment, your natural heartbeat picked up right away, and that was the end of the arrhythmia.
Dr. Wathen inserted a catheter in Harold's femoral artery and guided it into his heart, where a special procedure actually burns part of the heart and alters the current abnormal rhythm of the heart, changing it forever.
The heart rhythm problem, atrial flutter, was circuiting around this valve like this, and what we did was ablate it, so we got rid of that.
Having an electrical heart specialist on staff brings advantages to patients like Harold, who may have been dealing with arrhythmias for years.
This case points out that with a heart rhythm specialist, sometimes an existing problem can be dealt with in a new way or in a way that wasn't previously possible.
Today, Harold is back to doing things other than worrying about his heart.
I like fishing with my grandchildren and chasing them here and there wherever they go. And
Harold is thankful for the advances in healthcare and happy that he could benefit from them.
Medicine has come a long way, and I'm glad that Cookeville's coming along with it too.
For CookevilleTimes.com, this is Jill Bolling. Thanks for tuning in.